using some strategically placed incisions right around the ear here, called the tragus, and around the earlobe, back behind the earlobe in that crease, and up to almost right at the top of the ear sideways here. We want to come up about this high and then out onto the hairline here. That allows us to dissect up the skin all the way out onto the cheek and down into the neck, exposing, now that skin is kind of flipped forward, we're exposing that layer of tissue, and that's where the tissue that we need to reset. Now, there's different ways of doing that, and there's different techniques. A lot of us use an incision through that layer down into the neck. You get under that layer, and that layer is called a SMAS, S-M-A-S layer. We want to get underneath that layer and pull it back and put it back into position. So you can trim the excess, but you sew it actually into position. And what that does is it restores that fullness in the cheek. It gets rid of the jowling and softens that line right at the corner of your chin. So once we pull that layer back, now you can re-drape, and you do have some extra skin as we age, but now with that SMAS layer in place, that's the foundation for the lift. Now you can re-drape the skin and then trim the excess skin off and suture it into position. What that will do is tighten the neck, tighten the jawline, and tighten the cheek. So when patients talk about, I don't want to have a facelift, because they think the facelift is from the top of the head to the neck, the facelift itself is really from the cheek down into the neck. A neck lift is really just the lower jaw and neck area.